Yeah. Yes, Doctor.
Should I begin?
Yeah.
Yeah. Okay. Hi. Good evening, all. Myself, Dr. Himani Chawla. I have done my MD in dermatology from AIMS, and today we'll be talking briefly about the important topic that is sexually transmitted disease. With from this topic, we usually get a lot of question in our entrance examination. We'll be discussing step by step using the question-wise approach. Coming on to the first question. A 26-year young lady presented to the clinic with complaints of bony maturation along with frequent changing of her garments due to soakage secondary to copious discharge. On colposcopy, clinical picture as shown is found, what would be the next best option in the management of this lady? Now, if we talk about this question, so we have many approaches. First is if you know what this picture is talking about, you can directly answer the question straightforward. But the best approach always is to just notice the highlight key points which are given in the question. For example, in this question, we have burning maturation, copious discharge, colposcopic picture. So most likely the scenario given is of a BD, that is vaginal discharge. Now, if we know the picture, but it is exactly, then it is very easy to answer the point. But in case if you don't know about it, then we have to do the rule out approach. By that is by discussing each option in bit detail. So if we go option by option, first is to perform a pap smear, second is giving ceftriaxone single dose, third is performing routine urine examination and culture, and fourth is to give tablet metronidazole twice a day. Before answering this question, we need to know in detail slightly about VD so that we can answer this question. So let's go begin our topic. Just to give a clue, like if you want to get a clue that what this picture has resemblance to, I have given a clue. Now I think it has become easy for most of the people to know what exactly we are talking about. Yes, it is strawberry cervix. That's why I have given the clue alongside. But in exam, we don't usually get the clues. You have to identify the picture as such. A better representation, I have also shared this second image. Briefly, let's discuss about the topic in detail. We have three common causes of vaginal discharge. One is bacterial vaginosis, second is trichomoniasis, and third is vaginal candidiasis. I'll just highlight the important key points which you have to search in the question just to answer. Talking first about candidiasis, it's very easy to remember. Name itself is telling it is candidiasis, so the agent would be Candida albicans. We can remember C for Candida, and C for curdy white vaginal discharge. So it's easy to remember, and it is usually associated with significant pruritus. Talking about the second discharge, that is trichomoniasis. Trichomoniasis usually present with yellow-green discharge and minimally symptomatic one, and it is usually associated with the strawberry-appearing cervix, which we saw in the last question. The third is bacterial vaginosis. It is usually a vaginal dysbiosis. What does dysbiosis mean? That the replacement of normally found flora with the other organisms. And what are the other organisms usually found are these are Gardnerella, Mobiluncus, Peptostreptococcus, and Prevotella. The discharge commonly found in bacterial vaginosis is gray, homogeneous, and thin, as we can see from the image. Talking about the diagnosis of these three, as we all know, for fungal, we usually do the KOH of the examination. And what we get in the KOH is either we can get budding yeast cells, hyphae, or pseudo hyphae, as we can see in the image itself. For trichomoniasis, usually we made a wet mount microscopy, and in wet mount, what we get is, as you can see from the figure, a pear-shaped organism, and with the characteristic mobility that is jerky mobility. If we talk about bacterial vaginosis, we have two things to remember. That is, one is M-cell criteria and one is Nugent scoring. We'll be discussing M-cell criteria very shortly. Talking about treatment briefly, for candidiasis, we have 150 mg fluconazole single dose stat. And for trichomoniasis and for bacterial vaginosis, we have the same treatment, that is metronidazole 500 mg twice a day for 7. Just to remember, for if we talk about STD, we need to know about the color kit coded kits given by NACO for each STD. So for the vaginal discharge, the kit given by NACO is green color, that is kit number 2. The content it contains is fluconazole 150 mg single dose and secnidazole 1 gram BD. Just again to recapitulate how a strawberry cervix actually appear. On the background of a pinkish red background, we have multiple studded dots like this, which is known as strawberry cervix. Now, what you can see in this picture, if this is just to know how you can remember the things easily. So, if you can figure out what all things we can say in this picture is a tree, a strawberry. So, basically, it is a strawberry tree, and we can see the green leaves. So, how do you remember this? From strawberry, we know the strawberry cervix. From tree, we can remember we were talking about trichomoniasis. And from green leaves, we can remember the discharge we see in trichomoniasis, that is green yellow. So if you remember just one this picture, you can remember your trichomoniasis vaginalis very easily. One more thing from this which you can remember is the shape of the strawberry. If you see, it is like a pear shape. The shape of the organism in TV is also pear shape. So with just one image, you can remember your trichomoniasis very easily. Coming on to the MCL criteria of the bacterial vaginosis, there are 4 points. You need to have 3 points positive out of the four. Just to remember, it should be having thin milk-like consistency. There should be 20% clue cells. pH of the fluid should be more than 4.5 and it should have a positive whiff test. Now, talking about the things which you might not have heard previously, what are clue cells? Clue cells are a vaginal epithelium cell which gets coated with the bacilli. So, if we have this as a normal cell, when it gets coated with the bacilli, the cell which it become is known as clue cell. As you can also see in the picture, a normal epithelial cell and then a cell which become coated or loaded with the bacilli. So for BV, we should have 20% clue cells. Talking about whiff test, what exactly is a whiff test? If you add a drop of 10% QH to the vaginal discharge, if it has a fishy odor, then it is known as a positive whiff test, which is usually seen in the case of bacterial vaginosis. Now, how to remember these points in exam? We do have a solution. Just remember what are these two pictures? A buffalo and milk. If you can remember this line, you can remember MCEL criteria very easily. One point is missing. I am writing it here. So from this line, I am selling buffalo milk with the fishy order as 20 currency per 4.5 liter. So if we break this out from MCEL, we get the MCEL criteria. From B for buffalo, we get the bacterial vaginosis. From milk, we get the milky white discharge we usually see in BV or the first point of the MCEL criteria, from which we remember the whiff test, and which positive whiff test means a fishy odor already written in the sentence. So we have the second point of bacterial vaginosis. From 20 currency, we can get as 20% clue cells, which is the third point of the criteria, and per 4.5 liter means pH 4 more than 4.5, which satisfies the fourth criteria of the BV. So if you can remember the sentence, it has become easy for you to remember the criteria. Now, if we answer this question, now what it was, it is strawberry cervix. So it becomes very easy to you to answer this question. The answer should be patient should be given tablet metronidazole twice a day for 7 days. So that's easy to answer a question. If you know the image, you can just answer it as a straightforward. The next question is colpitis macularis is seen in which STI? Just a one liner, all you need to know about it is what is colpitis macularis. I'm very sure if I'll show you the image, you all can guess correctly, but in many cases, examiner doesn't provide you the image because he want to check whether you know this word or not. So if I'll show you the image, yes, it is the image which you saw just in the previous question. That is strawberry cervix. So what exactly is colpitis macularis? Colpitis macularis is other name for your strawberry cervix. So if you know what colpitis macularis is, in which condition it is seen, it becomes easy for you to answer that it is seen in trichomoniasis. So we have completed the first key topic for STI, that is the vaginal discharge. It has two more topics, but we'll be discussing just one more, that is genital ulcer. Usually you get one or more question from genital ulcer definitely in your exam. So if you remember this slide, this is the key star slide for the session. It becomes easy for you to answer your question. So in the scenario given, usually you'll be given a clinical scenario, a man presented with this, he has this or that. Just see these high clue points given and you can conclude your answer. First, you see whether there is any lymph node enlargement given or not. If there are no lymph node enlargement and the ulcer given is beefy red, your diagnosis straightforward become to donovenosis. You don't need to think about it anymore. But if there is a lymph node enlargement, you need to see whether the lymph node enlargement is associated with any pain or not associated with any pain. Suppose if it is not associated with any pain and the ulcer is also painless and indurated, again you have a clear cut diagnosis of syphilis. You need not to rethink about it. But what if the lymph node is associated with pain? If lymph node is associated with pain, you need to see the ulcer characteristic. What it is, if it has a transient ulcer or there is no ulcer at all, still it becomes easy for you to answer that directly. It goes to the LGV, that is lymphogranuloma venerum. But if ulcer is given, it is painful, you need to see the ulcer characteristic. If there are single or few ulcer with a necrotic base, your diagnosis becomes chancroid. But if there are multiple ulcer with the polycyclic margin, polycyclic means just like a cloud, then your diagnosis become herpes. So if you remember your this slide, your answer to genital ulcer question in exam will never go wrong. I'll just briefly show you how these ulcers look like. We already discussed herpes genitalis have multiple lesions. The initial lesions are vesicle. When these vesicles will rupture, it will leave behind this polycyclic ulcer. You can make it out. So if you get this type of picture and if you can see the depth, the ulcer are very superficial. So if you get this type of scenario, the answer is very straightforward that the ulcer is herpes genitalis. Many a times they can directly give you the image and can ask you questions pertaining to this. So if you know the image, you can answer it. Now, what is the treatment given for herpes as per NACO? It is acyclovir 400 mg TDS for 7 days and the color of the skin is red. How to remember this? Very easy. If you remember this one sentence, her red cycle, you can conclude your or you can remember your this thing. For her, you have herpes. For red, you have red colored kit. And from cycle, you know it is acyclovir. So if you remember this thing, your answer to herpes become very easy. You can also remember in the other way that is for red skirt, but for skirt it is superficial because it's the only ulcer which has superficial depth. All ulcers are deep. So just to remember that herpes ulcer is superficial, you can remember in this way. But if you need to remember the treatment, you can remember in this way also. Talking about the second ulcer, we have chancroid. We already discussed in that flow chart that if you have single or few ulcer, you can see there is one. So there were few ulcer with the necrotic base. You can see the pus at the base with the dirty looking necrotic base. And if you see the margins, the skin is present there, but ulcer is going beyond the skin. So the margins are excavated and the margins are very irregular. So if you have this type of characteristic that you have undermined edges, you have poor and dirty gray base, then your answer is chancroid and usually it is associated with same-sided unilateral suppurative lymphadenopathy. If you see the lymph node also has enlarged and form a pus-like collection. So it is usually associated with the unilateral suppurative lymphadenopathy. How do you remember chancroid? If you can remember this picture, you can remember chancroid very easily. C for chancroid and C for coal miners. So if you remember the scenario, there are 3 or 4 coal miners. So there are few lesions. If you see the lesion is excavated. The floor is top is here and the base is here. So the lesion is excavated, just like the chancroid lesion, and the margins are irregular, so the margins are ragged and undermined. And usually while coal mining we get the surfaces are dirty, the hands are dirty, so the base usually become dirty. So and they are all are working at one side, so usually we get one-sided lymphadenopathy. So if you remember this image, you'll not forget your chancroid. The third ulcer which we'll talk about is donovenosis. For donovenosis, you just need to remember two things. One is the red beefy ulcers which bleed easily. If you'll just have the look of the ulcer, you will get to feel that this ulcer might even bleed on just a superficial touch only. So the ulcer, red beefy ulcer that bleed easily, is your donovenosis. And the other thing you need to know about donovenosis is that there are no lymph node enlargement. The surrounding soft tissue become thickened and form a swelling, which we know call as pseudobubo. Why we call it pseudobubo is because the lymph node enlargement which we see in genital ulcer is known as bubo. But since there are no lymph node enlarged in donovenosis, but we get a similar enlargement of soft tissue in donovenosis, we call them as pseudobubo. So they can directly ask you pseudobubo is seen in which condition. You should be knowing it is donovenosis. If you need to remember donovenosis, just remember this one sentence. We always say donate blood, a very common saying. So from donate, we have donovenosis, and from blood, it is the bloody ulcer that is used, which even bleeds on touching. So you can easily remember your donovenosis. The fourth one is LGV, that is your lymphogranuloma venerum. In lymphogranuloma venerum, you just need to remember it as L for lax, G for genital, V you can assume as U, so it is ulcer. So in LGV, you usually don't get your genital ulcer, or it is very transient to see. So from LGV, you usually what you get is a clinical image of enlarged lymph nodes, not a ulcer. And what happen is this is your inguinal or Popat ligament. Two group of lymph node, that is one above the ligament and one below the ligament, becomes enlarged, sparing the Popat ligament. When it becomes paired, the space here formed takes the form of a groove. So the sign this is seen is known as sign of groove. So it can be asked as one liner as groove sign is seen in. So you need to know about LGB, right? The last but the most important one to talk about in genital ulcer is syphilis. For syphilis, it is just easy to remember it. It is the silent killer because it is not associated with pain at all, but it is the most devastating ulcer as it can lead and spread to your multiple organs. So if you see the ulcer characteristic, it is always painless. Mostly it is single, and if you see the rim of this ulcer, it is very much thickened. You can see the thickening this ulcer is showing. So the rim is showing a button like induration, which is very much characteristic of syphilis. No other ulcer has an induration except for syphilis. So this induration point is very much in favor of syphilis, and the edges are very much sharply demarcated and variable. And if you see the lymph node enlargement, it is non-tender. So it is always the silent killer, means the ulcer is painless, the lymph node is also painless. The treatment for syphilis, you all are well aware. For syphilis, we give benzathine penicillin. But if the syphilis is an early syphilis, we just give one dose of 2.4 million international unit. While if it is the late syphilis, you give three doses, one dose each week. And if we talk about the NACO color coded kit, we have white color kit for syphilis, which has this injection benzathine pencil along with the tablet azithromycin. Just wrapping up this scenario with genital ulcer, just see the question and you'll be able to answer. 18-year-old adolescent presented to OPD with complaint of burning micturition since last 3-4 days. On asking a history of unprotected intercourse, present 5 days back. Examination, she is found to have multiple. See the number of lesions. Tender means it is painful. Erythematous, superficial ulcer. I've already told you in which scenario you get superficial ulcers associated with bilateral non-suppurative lymphadenopathy. As per the scenario, choose the inappropriate statement. So from now, you could have easily found out multiple painful ulcers and that too superficial. You know which ulcer you are talking about. Yes, we are talking about herpes. So when you can easily conclude which ulcer we are talking about or which type of organism we are talking about, even if you cannot identify the picture, you can answer your question. Or otherwise, from photo also you can answer. See the multiple vesicles which we see in herpes initially, and when it rupture, it leaves superficial ulcers with the polycyclic margin. If you join the margin, you get this cloud-like margin. So definitely from image also you can confer that it is herpes. Now we have to choose the statement which is correct. Most common organism responsible for disease is HSV2. Definitely, yes, herpes is caused by HSV2. Gimsa will reveal multinucleated giant cell. Yes, when we talk about herpes, we always talk about zinc smear, which we make from the base of the lesion. And on stain, for zinc smear, we use the Gimsa stain, and when we examine it under microscope, what we get is multiple nuclei present together in a cell, which is known as multinucleated giant cell, and she should be treated with red color NACO STD kit. Very right. We remember it as her red cycle. So for herpes, we have red color kit. So it is absolutely right. Her partner should be treated simultaneously using the same STD kit. No. For herpes, we usually don't give the partner treatment, which we usually give in other STI. So that is also an important point when we talk about herpes, that we don't treat partner in case of herpes until and unless partner is having the similar lesion. So the correct option here becomes the D. One more scenario just to identify the ulcer. See, there's a male, sexually active, unprotected intercourse. 5 days later, he developed multiple painful, foul smelling ulcers with ragged, undermined edges, minimal enduration. 2 days later, he developed left sided inguinal swelling. On interrogation, he recalled an episode of allergic reaction to penicillin. As per the given scenario, which one is the best option? To answer this, first you need to figure out which ulcer we are talking about. So, if you join the words, we have multiple painful ulcer, foul smelling ulcers with ragged undermined edges. Can you recall what we are talking about? If you remember that coal mining picture with this kind of ulcer with a dirty base, yes, we are talking about chancroid. So when we know we are talking about chancroid, it is very easy for us to answer this question. Dark field examination of the smear, no. For we do dark field examination only in case of syphilis because it is caused by a treponeme. And as we know, we are not dealing with syphilis. We won't be choosing this. Zank smear from the base will show MNGs. No, we already discussed in our last question that Zank smear we make in case of herpes will show multinucleated giant cells. So this is also incorrect. Taking swab from the ulcer and sending for culture, okay, we'll think about it. And administering NACO kit number 4 as per syndromic management. So if you remember from the NACO kits, the kit number 4 is given when we have a allergic reaction to penicillin, and we have been given in question that there is an episode of allergic reaction to penicillin. So should we mark this? No, because the kit 4 is given in syphilitic ulcer allergic to penicillin, and the ulcer given in this scenario is not a syphilitic ulcer. This is chancroid ulcer. This line is just given to confuse you all so that you answer straightforward as kit number 4, because the characteristic given is of chancroid and not syphilis. So the answer here become is C, that you take a swab from the ulcer and send it for the culture, because for chancroid the gold standard is taking the culture swab. Last topic is syndromic management. In all your questions, we were repeatedly talking about the STD color coded kits. So that is the ultimate topic. In each exam, you always have 2 to 3 questions from this color coded kit. So you need to know about these kits. This should be on your tips. So what is syndromic management? Based on common symptoms and signs, you treat a disease without finding out its cause. You just directly treat it for its common cause. Suppose an entity like vaginal discharge has 3 common causes: your bacterial vaginosis, your trichomoniasis, and your candidiasis. But you treat all three simultaneously without get making any diagnosis straightforward. This is your syndromic management. So this is the chart you all need to remember. If you see, we have how many kits it has? It has 1, 2, 3, 4, 5, 6, and the 7. So we have total 7 kits. Kit number 1 is gray, kit number 2 is green, 3 is white, 4 is blue, 5 is red, 6 is yellow, and 7 is black. What you all need to know is you need to know color as per the number also, because many a times they can directly write kit number 3 will be given. So, hello.
Actually, this is not a paid version, so it got over, I guess. No, the time is there.
Actually, I just got a call in between, so it got interrupted.
Oh,
Should I
yeah.
continue or should I pause it here?
It's recording. Yeah, you can continue.
Okay, fine. So many a times in exam, what you do is directly they can write as kit number 3 should be given, kit number 4. So you need to know the color of the kit as per the number also. You need to know which kit is given for which entity, and you need to know the content of the kit also. So this slide is ultimate. You have to remember it anyhow. It will also be exam asked in your exams also. So how to remember the sequence? It is, I used to remember it as this. If you can remember in this way, great Greeks wear gloomy red yellow bag. So from great you have gray, from Greeks you have green, from where W you have white, bloomy stands for blue, red is for red, yellow is for yellow, and for bag is for black. So if you remember this sequence, it becomes very easy for you to tell that kit number 1 is gray, green is 2, white is 3, blue is 4, red one is 5th, yellow is 6th, and black is 7th. So just one sentence and you can easily remember the number of your STD kits. Now, what it all for what condition each kit is used? For gray kit. If you can remember, this is kit 1. This is a very famous character if you can recall, and you will always see him running like this. Elderly man running for frequent maturation. So, what it can indicate? It must be for your urethral discharge. The image here also depict an elderly man with the complaint of frequent maturation. That is the urethral discharge only. That is his sorry. And why I have highlighted this elderly male? Because from elderly you remember the gray colored hair or the gray color kit. So it becomes easy for you to understand. And what does this kit contain? This is Cefixime 400 mg single dose and 1 gram azithromycin stat, single dose of both the tablets. So this kit is for urethral discharge and this contains 1 tablet of cefixime and 1 tablet of azithromycin. If you talk about green kit, if you remember from the mnemonic great Greeks, so the kit 2 is green kit. How to remember for what green kit is? This is a very famous advertisement of a sanitary napkin, and from this color of this napkin you can remember green color, and usually from the this advertisement only you can remember that this must be used for vaginal discharge. So it become easy for you to remember that which color kit, green color kit is for which entity. And if you need to remember the content, secnidazole 2 gram tablets, 2 tablets usually you get 1 gram, 1 BD dose it is there, and 1 tablet of fluconazole 150. So you have these two things in your green kit. If you talk about your white kit, I have shown you a syringe or a injection. The only kit which contains the injectable or injection is the white kit, and usually the color of your injectable or injection is transparent white. So you can remember this in this way. And the only STD where you have a injectable in a STD kit is your syphilis. So if you can remember as the for injection, you need the syringe, and the syringe is also white, so it will be in your white kit. You can remember that the white kit is for syphilis. And what does it contain? It contains your injection benzathine penicillin along with single dose of azithromycin. But suppose if the patient say, no, ma'am, I cannot take injection. I am scared of injection. Kindly give me something else. So what you will give? Either you will give capsule or you will give a drops. And if you see the color of both, it is blue. So what it is, I have given this just to make you remember. If the patient is intolerant to injection, what you will give capsule, blue colored capsule. That is blue colored kit containing a capsule. And what this capsule is, capsule doxycycline. So if the patient is intolerant to benzathine penicillin or is having any allergic reaction to penicillin, we cannot give white kit. What we'll give? We'll give kit blue, which contain capsule doxycycline. This we have already learned. Her red cycle, her is for herpes, red is for red color kit, and cycle is for acyclovir. So kit number 5 contain your red kit contain acyclovir, which is for herpes. Your yellow kit, if you remember, your kit number 6 is your yellow kit. Yellow in Hindi we call yellow as peela. It become easy for you. So just a second. Just remember P for this. For P, it is the peela kit. It is for पेट में दर्द, because the yellow kit is for lower abdominal pain. So if you remember, this Pila kit is for your pet mein dard, that is lower abdomen, and we have one more P, that is the cause of this lower abdomen is PID. So if you remember P here, you can remember what this yellow kit is for. Pila kit for pet mein dard, which is due to PID. And what does it contain? It contains metronidazole 500 mg, metronidazole 500 mg for 14 days. You have your capsule doxycycline for 100 mg for 14 days, and you have one single tablet of cefixime 400 mg. So this is what is contained in your yellow kit. And PID, you have this pila color purulent discharge, so that's why I've highlighted it here also. The last kit which you can remember from this poem which you used to hear in your childhood days, if you remember this poem, Ba, ba, black ship, have you any wool? Yes, sir, 3 bags full. So from ba, ba, black ship, Baba ko you can write as bubo, and black is for black kit. And so black kit is for your inguinal bubo or your scrotal swelling. And what does it contain? It contains capsule doxycycline. One important thing which you can get from this poem also is, one thing you have got is your Baba black sheep, that is the black color for bubo. One more thing you can get see here is 3 bags full. So if you can see the 3 bags full, one more indication is 3 weeks. This is the only STI kit in which the treatment given is for 3 weeks. And mostly you get it either as a single dose, either for 1 week or 2 weeks. But this is the only STI kit in which you have the treatment for 3 weeks, that is 21 days. So from just this image, you can remember all those things. This is what all we have discussed in our slides. Kit number 1, 2, 3, 4, 5, 6, 7, for which condition we have given, the color we have given, and the content we have already discussed. Thank you.
Yes, doctor, it was good. So I've recorded it. I will forward it to the team and I'll get back to you soon.
Sure. Yeah.
Thank you.
Okay. Thank you.